Well, hi, everyone, and welcome to the MGMA Business Solutions Podcast. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. Today, we're talking about a topic on every practice leader's mind, how to balance AI and human talent so you can run a smarter, more trusted operation and practice. Today, we have a guest that I had an opportunity to work with on a recent webinar, and we're going to link to that webinar so you can capture that on demand as well. But we have Dr. Rihan Javid today. He's president of EDGE and CEO of Rinova AI. So, Dr. Javid, first, good to see you again.
You too, Daniel. Thanks for having us on. It's a pleasure as always. So I know we've been working with MGMA for a couple of years. It's always a great event. So.
It really is. So a couple of questions just for clarification, because I keep going back and calling you guys, EDGE Health, Rinova AI. Help us understand a little bit about the organization that you're the founder of, and to bring us up to speed of what you guys do and how those two different titles sort of mesh together there.
Yeah, definitely. So, a few years ago, we started EDGE Health, which is, it's kind of an employer of record where we have people in multiple different countries. So Pakistan, Peru, Costa Rica, and a couple other smaller countries throughout the world. And what we do is we provide remote talent for medical offices, dental offices, and insurance companies. So we've been doing that for a few years. We have about 350 healthcare customers. And we have everything from solo practices to the largest physician-owned hospital in the country. And for those groups, we do everything from billings. We do billing, we do staffing, we do front office, back office. So pretty much everything across the board. And so one of the things we heard from our customers is that, this is going really great, but where's AI? How are you guys going to do this? We still want to grow, but it's still hard to find billers. It's still hard to find people who are able to do all of this. So how are we going to do that? And our CTO from EDGE, he's actually a PhD in AI machine learning. We sat down and he's like, look, billing, a lot of it's repetitive, a lot of it's really easy stuff. And AI is able to fix a lot of it, right? So when we first started, with Rinova, we were trying to offer maybe like a full solution where we take over your whole billing. But obviously these companies and healthcare practices, they've been doing it for years, and they're like, man, that's just too much of an ask, right? Because if you mess it up for a month or 2 months, you can't pay your staff, right? It's just not going to happen. And so we worked with them, and we used our existing solution and we really enhanced it into something called an AI agent. And so with the agents, it's just a software that does maybe 95% of your billing, but you still have your human team that supervises it. So your workflow stays the same, but you just have the AI that does most of it.
Okay. You were walking me through some sort of a demo on YouTube. You had some videos up there that were fascinating. I'm hoping we can get into those in just a second. But first, you do have that doctor in front of your name. So tell us a little bit about your healthcare background.
Yeah, so I was actually a lawyer beforehand.
Okay.
I went to law school. I did some healthcare litigation stuff, but I really wanted to go to med school. I think even when I was in law school, I was like, man, I should have done that. But at the same time, I was in there. So went to med school. I'm a psychiatrist and worked on the administrative side for the past 3 or 4 years. Chief medical officer at one of the hospitals here in California. And, same problems, a lot of billing, a lot of compliance issues, underbilling, overbilling, miscoding. And so we've been able to work with, the hospitals, the different stuff, use my experience from this and really apply it to the different aspects of both EDGE Health and Rinova.
Okay. Now, you have been talking about those challenges with billing. You were talking a lot about it to me offline. Just looking at it, because you have really studied this topic, why are there so many issues with billing? And then it provides an opportunity for organizations like you to come in and fill those gaps. What's going on with billing that seems so problematic in healthcare?
I think there's a few different things, right? So the insurance companies are probably one big part of it, right? They don't want to pay what the contracted rate is, right? They're really making it hard on practices. I think that's one thing. The other thing is it's hard to find a good billing and coding team. If you have someone, you pay them, some places $25 an hour. They stay with you for 6 months. They learn your systems, and they go across the street to, UC San Diego, Scripps, where they're paying $35 an hour, pension, all this stuff. And so it's really hard to compete. It's really hard to keep a talented team together. So I think those are two parts of it. The other thing is billing and coding. It's such a large expense for most medical practices, um, anywhere between 4 to 8%. We've seen, and so if you have 10 doctors, maybe your annual revenue is 10 million. Out of that, you're paying $500,000 for billing and coding, and it might not even be right. And so
Mhm.
we just think that's too much. It's just putting too much of a burden on your team and on your practice to pay that much. And so really our goal is to bring that down from 5% to less than 1%.
Thank you for that. Now, one of the things that was so interesting in the webinar recently, and what we're going to talk about here, is really peeling away the layers of understanding the AI human balance. We all hear about AI now, and then some people go, well, does this mean I have a job anymore? And you've got a really interesting take on here. So what are some of those operational tasks at a practice where AI is excelling, but then where do we still need those human beings to be part of that production cycle as well?
Yeah, great. So I think there's a few things on there. I think the main area where AI really excels is in repetitive tasks, like simple stuff, right? Just copying, pasting, like coding, coding a note, right? So it's an algorithm, right? It's just like step one, step two, step three. Do you have these criteria? Send it over. Also, when you code the note, then you got to submit it. A lot of times you're copying and pasting data from one software to another, and then you got the payment or the check, and then you got to pay, go back and paste that, right? So it's very simple stuff. But do you really want to pay someone $35 an hour or $20 an hour? And do they really want to do that? I think a lot of times, no. Sometimes, people love it, and that's great. But I think those things are really easily helped with AI. And some of the stuff that's not is, I know there's like agents or chatbots that will answer the phone call. I mean, I have Verizon, and man, or even like calling my doctor's practice, if they're like, oh man, press one and we'll send you a text and you can communicate with that. Oh, it's hard,
Yeah.
right? You just want to get on there, you want to talk to someone. And I know like my parents, my like in-laws, everyone, right? They're 60s, 70s years old, and they don't want to deal with that. They just want to just talk to someone really quickly. And what this does is it really helps you transfer people from these repetitive tasks back office where they're not seeing anyone to really your patients, and really giving your patients the attention that they need.
Okay. Thanks for that. Now, one thing that you were walking me through before we went live here is an AI agent. You showed me a little bit of a demo on YouTube, and hopefully you can let me know if we can share that link with our audience. I don't know if that's proprietary. But,
Definitely. Yeah,
okay.
yeah.
Oh, good, good. So let's talk about that and define it. What is an AI agent?
Good. So let me get the exact definition.
Sure.
An AI agent, it's basically a software that acts as a human and does whatever a human can do, right? So it's usually a combination. So I know pretty much everyone's probably heard of ChatGPT at this
Right.
point, right? So ChatGPT would be the brains of the agent,
Mm-hmm.
and then there's a memory, and then there's tasks, right? So the task could be logging into the EHR, pulling up the schedule for the day, finding the first patient's note, coding that note, and submitting it. So the agent would be trained on those things, so it can do all of those things as well as payment reconciliation, whatever you want. And so the agent is basically a computer program that acts as a human to do all of those different tasks. And so it could be something as simple as just logging into a software to running your whole revenue cycle. And instead of taking 10 or 15 minutes per patient, it can do it in 20 seconds.
Wow. Wow. And you walked me through it, and I saw it live, and we'll share that link with everybody. So what we keep hearing about AI is it is rapidly evolving, rapidly changing. So what are the roles of agents in the future of AI as that continues to grow and evolve?
Yeah, I think we spoke about a month ago, maybe, and at
That's
that
right.
point, our agent was like very early, right? We didn't even mention it, I think, in the webinar. Since then, it came to market, we've gotten like multiple different agents, and we've applied to different parts of it. So yeah, I think the roles of the agent at the very beginning, probably revenue cycle management's really easy to do. AI scribing, I think, is hit or miss. I think some of the better ones can get maybe 90, 95%. So you still have to go through, so spending time on that. I think those are probably, maybe the two easiest to
Hmm.
do. And then obviously there's like phone agents and stuff like that, which I think, we already discussed. I think, it seems like both of us agree that's a challenge, right? If you've got to
Right.
call somebody and you can't get a hold of them,
Right.
I think that's a challenge. So I think that's maybe further down the road, but definitely, the ability, the prior authorizations, the eligibility, where you just log into a computer, figure the stuff out, and then post it. So I think that's probably the future, the immediate future, maybe like 1 to 3 years. AI scribing is kind of the same thing. It's already here, but maybe not quite where it needs to be. And then I think the answering services that are AI, I think those are, I don't know if they're ever going to be like 100%. I don't think they're ever going to be 100% because I just want to talk to someone, right?
Right.
I want to like run into a machine and go back and forth. I think, yeah, I like talking to people, and I think that'll
Right.
be limited. So.
So I'm asking you a question. You have that legal side of your background. That may not be muscles you're exercising all the time these days, but this is a general question. If you know it, please share with us. But when we as a consumer are talking or interacting with someone in a chat room, do we know, or is it legally bound to tell us that it's an AI, or is it fine that we don't know? We could be talking to a chatbot, we could be talking to a human being, but we don't really know. Is that something that you have knowledge of?
I'm not sure. There's no, I don't think there's any federal guidelines. And I think
Okay.
even states, like I live in California and I haven't seen anything in California.
Okay.
And whenever I call like insurance companies or, you know, Verizon, T-Mobile, whatever, I've never heard anyone say this is a chatbot. So I don't think there's
Okay.
anything on that. Unfortunately, I think it'd be better if there was, but
Okay.
fortunately not there.
Yeah, I was just curious about that. Let's go a little bit deeper then. When we're really talking about the benefits of bringing together both the AI and that human element, when you're using those AI agents, you've talked to me previously and in that webinar about the reducing cost. Talk about that. Where are those costs coming down, and how low can the cost go for a practice?
Yeah, that's a great question. I think it really depends on the practice. So, we use an average primary care practice where the doctor bills about $1 million a year, about $80,000 a month, plus or minus. Some places higher, some places lower. And so right now, if they're paying about 4 to 5%, maybe 6%, that's about $50,000 a year, which is quite a bit, right? Imagine you can take put in your 401k, take your kids on, summer camp, vacation, whatever it is, right? Save for your family, or your staff or whatever it is. So that's, a significant amount, right? So say if you have 10 doctors, that's $500,000. And a lot of that's just wasted time that you can take those people, your staff members, put them patient facing, whatever you want, right? So I think we can bring that $50,000. We already are that $50,000 per doctor down to about 5 or 6,000.
Okay.
So all of a sudden you're seeing, 5% to about 0.5, 0.6%. They're seeing about an 88% savings on your billing costs overnight.
Okay.
But it's
Wow.
pretty substantial. If someone
It's
came
huge.
to my hospital and they're like, man, we can save you, you know, tens of thousands per doctor. That's
Right.
amazing.
It really is. It really is. So I want to ask you, just shift a little bit in some of our final questions here and ask you about this is what I found so fascinating in your webinar, where you were talking about preserving empathy and trust in patient care. There's surveys and studies out there where there is some distrust of the healthcare system. It might not be the individual practitioner or clinician, but it's that system. So you want to preserve that empathy. How do you do that while also introducing so much of the AI and the technology out there?
Yeah, no, I agree with that. So I'm a psychiatrist, and a firm believer that without the empathy, without that doctor-patient relationship, it's just not going to work.
Mhm.
I think there's countless studies out there that show that power of the kindness that doctors and nurses and the staff show is probably the most important part in the healthcare system. If you don't have that, it doesn't matter what medications you get. People just aren't going to trust it. They're not going to believe in it. They're not going to take it, or they're not going to have that mind-body, I think, connection that we really need to heal. And so if you don't have that, if you just have, whether it's just like a machine, an AI, an agent, a bot, whatever you want to call it, that's all you have. And there's no two ways. There's no listening. I think
Mm-hmm.
to the patient, there's no understanding and there's no eye contact, there's no touching. Even just shaking someone's hand makes a big difference. I think if you don't have that, it's just not going to work. You really need, you need that human touch. You need that connection. Because we are social animals, and you do have to do that. If you don't, it's just not going to work. And I
Right.
think, so AI can help back end, really great. Front end, talking to your patients, treating your patients, maybe like, one day, but I think not our future. We're social animals. We need that connection.
Yeah. Final question, then I'll give you a blank slate here. Is there anything I didn't ask about AI and that human connection here, that balance there, that you'd want to share with our audience that maybe I didn't bring up?
No, I think, we talked about a lot of it. I think it's ongoing. It's changing dramatically. I think it's a pendulum. I think what's really important for most practices, trying to keep your core, kind of keep your essence of who you are, and bring in, little bits here, like whether it's the AI agent to help with billing or this or that. But don't let AI or computers or anything change who you are. Don't let it change your practice, and don't let it change your connection with your patients. But at the same time, use it, maximize it to increase your staff satisfaction, your patient satisfaction, and ultimately your bottom line. Because that's what's going to help your staff, treat your patients, make sure they're not overworked, and use this to minimize that stuff. And I think, you'll probably succeed, and you'll do pretty well. So.
All right. Well, Dr. Javid, I want to thank you so much for joining us on the MGMA podcast. Great seeing you again.
Yeah, no, great. Thank you. I think, are you going to be at Orlando
I
event?
sure am. You going to be there?
Yeah, I'll be there. Yeah,
All
end of the
right.
month. I'll see you guys there. If anyone's on the fence, we've been, I think, 3 years in a row. It's a great event.
Right. I'm looking forward to getting to shake your hand in person there. So that's going to be fun.
Great.
Yeah. All right. Well, everyone, I have mentioned the webinar on several occasions. It's on demand. So what I'm going to do is provide a direct link to that. I'm also going to provide some other resources, as Dr. Javid was showing me earlier today, a short demo of on YouTube of what this AI agent can do, and it's pretty impressive of how quickly it can analyze all the information out there. A great time saver. So I'm going to provide those resources as well. So until then, I want to thank everybody for being MGMA podcast listeners.